Hello everyone, this is Dr. Mohit and welcome back to this series where we discuss about all the high yield points in a very crisp manner. And today we'll be reading about contact dermatitis. So just before starting with the topic, right, I'm pretty sure this condition we might have seen probably in our friends or relatives or somebody, right? So somebody has this issue every single time, probably if they are wearing some jewelries or they just bought something off the market and it's not like that good quality. It has some probably irritant metals like nickel or something, which irritates their skin. Yes, and we could also be seeing this, probably if we just get something from the market. For example, we just got a moisturizer, right, and in there we just apply it and everything is fine, but after some time we feel that okay, fine, there is some sort of redness in that area which we applied. So that is one of the type, right? That is allergic contact dermatitis. Yes, and a few questions for you ahead as well. Yes, so because this will be a hypersensitivity reaction and we just got finished with that. So one question regarding hypersensitivity is waiting for you guys. All right, so with that introduction, let us just get on to the details with the topic. Okay, so first of all, the definition, right? What would be the definition? How would we define this contact dermatitis? Yes, so it would be like a localized inflammatory response, yes, to either it could be a chemical irritant or a physical irritant. Yes, it could be either two of them, right? So let us just go fill in our notes. It could be chemical or any physical irritant. Okay, and what does it result? As you can see in the images, right? How would you describe the images? Even in our introduction topic, right, we were talking extensively about how to describe the images. So how would you say that? Okay, fine, red, so it's going to be erythema is going to be there, right? Okay, and what do you think whenever somebody has this sort of dermatitis? Yes, so there's inflammation, so there's going to be edema. Yes, so which results in edema and erythema. Okay, fine. So we have just defined contact dermatitis right away. And first of all, let us just go on to how we would classify this. Yes, as we just said that okay, fine, there could be something, it could be physical or either it could be some chemical. Yes, but the way the body is reacting to the exposed chemical or any physical irritant is different. Yes, the etiology behind is different. So this classification is based on the etiology, like why that is happening. Okay, first of all, we have the irritant contact dermatitis. Yes, and the next one we have allergic contact dermatitis. Okay, pretty simple. Yes, irritant or allergic, but the thing is, if you are a good clinician, you would know that why that is happening, what is the factor that it is causing that condition to be seen in a patient. All right, so in the first one, it is a pro-inflammatory cytokine, that is the reason the whole mayhem is happening. Okay, and what do you think is right here? So that is the question I wanted to ask you about, right? Yeah, so what is that? First of all, it is a type of hypersensitive reaction. Okay, fine. So do you think like in type 1, 2, 3, 4, which type would it be? So please remember that we just discussed about the hypersensitivity reactions, right? So it is going to be the delayed type. Yes, so I hope you're getting the answer right. Yes, so it is going to be type 4. Yes, it is a type 4 hypersensitivity. Okay, pretty simple. Okay, fine. So let us just see about the level of irritants. Yes, so what do you think? It is pretty easy question to answer right here. The level of irritant depends on what? Yes, it depends on what, because it is, and this all the condition is being caused because of some substance being abusing the skin, right? So if it directly would be proportional to the amount and time of the substance which is being in contact with the skin. Simple, right? Nothing much complicated here. So the level of irritant depends on the amount and length, that is the duration, amount and length of exposure. Okay, all right, so we got one thing done, that is how it depends upon. Okay, and next we have the list. Okay, the list of things that could cause all this mayhem. First of all, we have the chemical irritants, yes, and then the physical irritants. All right, so let us just go on and read up with that. So chemical irritants, it could be like, you know, some conditions like wash a woman's hand. Yes, that is one condition. Because of that, because of this detergent, right? It could be some detergent not so good quality, you know. It could be good quality as well, but there is some agent in that which is not really suiting the person. Okay, detergents, some cleansing agent, alcohol based sanitizers and soap, yes, and benzyl peroxide as well, or bleach, because see, all these chemicals, right, these are harsh. They are not a very mild chemical, so their pH would be quite acidic, yes, and whenever we apply any moisturizer or anything on skin, so anything which disturbs the pH, you know, could cause some sort of mayhem, and everything listed over here is supposedly having an acidic pH. Okay, all right. How about the physical irritants? Yes, so the main one would be the metals. Yes, probably if as we just discussed, that if somebody just got some jewelry, probably some metal bands, you know, or some necklace. Yes, as in the image also we saw. In that, it could be somebody maybe just got a watch. Yes, and because of the band, yes, everything is good well in the evening, but in the morning, for example, the person is wearing the watch, is sleeping off. In the morning, he notices that, okay, fine, there is a whole mark, there is a whole like demarcation in his on the wrist area. Yes, that could be because of the watch. Yes, and it could be under the category of physical irritants. Okay, as simple as that. All right, so the fiberglass work, and even the plant parts could have like this thing is pretty common, you know, even though it is not discussed that much. So probably if somebody does not go out in the woods that much, and some evening, you know, we just go for a walk and we come out, probably, you know, we just got brushed off with the leaves or anything, you know, bushes. So it could happen like, you know, we could have some red erythema on our skin. Okay, as we described. Yes, that could be one of the condition. All right, so going on to the next part, right? So the work environment. So the work environment plays a huge role in this one. Yes, for example, if someone is working in just for say he's working in a cotton factory. All right, he's working in a cotton factory and he is allergic to that. Okay, but the person is illiterate, he doesn't know about it. So what's going to happen is, from Monday to Friday, he will have some sort of allergies. Yes, but on Saturday and Sunday, for example, he's having an off. Yes, so he will be absolutely fine. Yes, I'm talking about if he has an allergy on the skin, not with the inhaled one. Okay, the inhaled one is a separate topic. Okay, so the work environment definitely plays a role if somebody is working in a fiberglass factory. Yes, and he has to use something, and there are no proper protection being given to the worker for per se. These conditions could be elicited. All right, the next one, the clinical manifestations, right, as we just mentioned in our definition, right, there could be edema, and there could be it could be erythematous as well. The red findings we have, definitely pruritus is going to be there. Okay, but so it's going to be dry red pruritic skin, and vesicles could be there as well. Okay, all of this, right, all of this abuse in a very long term per se, it can cause a skin atrophy and necrosis if just ignored the findings, right. So this could have happened. One of the example is the bindi dermatitis. Yes, for example, the person doesn't know and the person is applying the bindi, and because of that, right, a very long duration, there could be hyperpigmentation, and we could see skin atrophy and necrosis as well on the skin. Okay, how do you diagnose it? So the patch test is a very common question asked in our MCQs. Yes, let me just zoom a bit in. Okay, so the patch test is a very common thing, right, we use. Yes, but in our clinical findings, we ask this patient to do the patch test. For example, there are almost 64 types of antigens, which are done commonly on the back. It would be done. We will discuss this in the image based session as well. Yes, so how would we describe the image? Like the patient is sitting and there is a photo of the back and there are a lot of small patches applied on the back. Yes, so and the duration is asked, like on what duration would you go and check the patient that, okay, fine, that is the specific thing you are allergic to. It would be between 48 to 96 hours. Yes, and 72 hours is the best finding in this one. Okay, it is a specific range to it. Okay, the higher the better in an MCQ. All right, that we'll discuss again when we do the image based discussion, but just for now, allergic patch test. Okay, and usually the diagnosis is clinical. Yes, we would just see, we ask the history of the patient, that did you had any exposure to XYZ thing, and we can just do clinical diagnosis of this condition. Okay, and how about the complication? Yes, so if the person is not very aware of this finding, and what could have happened is there could be scars on the skin, right? Because there is abuse on the skin, the body would react, and if this condition is going again and again, there will be scars. Yes, so all the healings, they end up with scars. Yes, okay, and loss of functionality, because the nerve endings could be damaged in that specific area. Very less likely to be found, but yes. Desensitization is just one point of that, and we could have secondary bacterial infections as well. Yes, because if the skin is exposed, yes, this could happen. All right. Treatment, how would you pause? Don't take the next topic in it. Okay. How would you do the treatment for this patient? It's very simple, right? So the mainstay of the treatment is going to be, we have to avoid the irritant. Yes, so this is the mainstay of our treatment. Okay, avoid the irritant and it should be fine. Yes, and if the patient is having dryness, we would give emollients. Yes, emollients, barrier creams, and gloves. Yes, if the patient has to do that work, for example, maybe maybe the patient has allergic related to some probably the patient is a chef. Okay, just for example. Yes, and he is allergic to a specific type of chili. All right, so he has to do it. Yes, so probably when he is doing it or when he's washing it, we can recommend him just to cover his hands. Okay, all right, so we could give these preventive measures. Okay, and in the severe cases, we would go ahead and give topical corticosteroids just to manage the patient symptomatically. So that was all about contact dermatitis, a very short topic, and I hope you guys liked it. And moreover, whenever we see the conditions, right, you should see that do we see a very proper demarcation in the skin, or is it like a very generalized findings? All right, so that could help us differentiate between the allergic contact dermatitis and the irritant contact dermatitis. All right, thank you so much for listening.